I'm Dr. Shira Parks, and this is my kitty Finnegan. Today we're going to be showing you how to accurately collect a blood glucose for monitoring of a diabetic kitty. So whether your cat's been newly diagnosed with diabetes or has had diabetes for years, it's very important that we're regularly checking blood glucose. And often we like to send people home with a glucose monitoring kit that often includes, or should include, a glucometer and a packet of glucose monitoring strips. Each of these strips is calibrated to specific to the cat. And so we want to make sure that when we're using our machine that we're checking the numbers on the side of the bottle and making sure our machine is calibrated to that to get the most accurate readings. Inside the bottle, you'll see there's just a number of strips. And to take one out, I just lightly dump them into my hand and pull one out. I have one here set aside. There's two ends to this strip. The flat end is the end that you put into the machine, and the smaller end is the end that you use to collect the sample. So when you put the strip into the machine, it should turn the machine on, and then you can assess the calibration and make sure that everything is correct there. And so when we're collecting a sample, it's very small blood that is required for this test, and a lot of test kits include a lancet with a lot of sharp points to help collect the sample, but today I'm going to be showing you how to use a 27 gauge needle. It's important to make sure that our hands are clean and that our kitties are comfortable. He's enjoying some nice scratches from Kylie. And making sure that we're using a brand new needle every time. We want to make sure that we're reducing the risk of infection into the cat's skin. So I just open up the needle and take off the cap. I like to set it down where I can access it again. And so then I just lightly pull back his ear and collect the sample. Having a helper is often very beneficial for keeping the cat still and relaxed. So they have a lot of good veins in their ears. And so often a small prick. I know, you only need a tiny amount of blood, so I set the needle down in a safe place. Sometimes if you don't get enough blood right away when you poke them, a little bit of squeezing will help make a bead of blood that should read on the machine. So once the machine is telling you it's ready to read, it's a little diagram on there that says it's ready to read. And then you just gently touch it to the blood and it wicks up the strip. And then you hear a beep and then it lets it read. And then I like to have a cotton swab ready just to put pressure to that spot and hold it lightly. I like to have a cotton swab ready so that we can apply pressure to stop the bleeding.